What do antibody blood markers mean for muscular dystrophy? Imagine trying to solve a puzzle where some pieces tell you a lot, but others are not as helpful. When it comes to muscular dystrophy, blood tests can give clues, but they don't tell the whole story. Muscular dystrophies are primarily genetic conditions caused by mutations in muscle-related genes. They are not autoimmune diseases, so the presence of certain antibodies usually doesn't indicate muscular dystrophy itself. Instead, antibody blood markers are more useful for ruling out other muscle problems that are caused by the immune system attacking the muscles. For example, tests for antibodies like anti-MuSK or antioch receptor are used to diagnose autoimmune neuromuscular diseases such as myasthenia gravis. These conditions can sometimes look like muscular dystrophy because they cause muscle weakness, but they are different disorders. If these antibodies are positive, it suggests an autoimmune cause rather than a genetic muscular dystrophy. Similarly, anti-nuclear antibodies are checked to see if there's an autoimmune process involved. A positive result might point to inflammatory muscle diseases, which are distinct from muscular dystrophy. The most important blood marker for muscular dystrophy is creatine kinase. This enzyme leaks into the blood when muscle fibers are damaged. Elevated levels of creatine kinase are common in muscular dystrophies like Duchenne and Becker. High levels often appear early and can be a strong sign that muscle damage is happening. These levels can be quite high, sometimes thousands of units per liter, and they help doctors decide whether to pursue genetic testing. Besides creatine kinase, other proteins like lactate dehydrogenase and troponin T can also be measured. These proteins are released from damaged muscle cells and can help track how the disease is progressing over time. They are not antibodies but markers of muscle injury. Monitoring these proteins can help doctors see if the muscle damage is getting worse or if treatments are helping. In practice, if blood tests show high creatine kinase and other muscle proteins, doctors will often order genetic testing to look for mutations in genes like the dystrophin gene, which is responsible for Duchenne and Becker muscular dystrophies. These genetic tests confirm the diagnosis. Blood antibody tests are mainly used to exclude autoimmune muscle diseases that might look similar but requiring different treatments. So, to sum up, antibody blood markers do not directly diagnose muscular dystrophy. They are mainly used to rule out other conditions caused by the immune system. The real clues for muscular dystrophy come from elevated muscle enzymes like creatine kinase and other proteins that leak out when muscle fibers break down. These markers help doctors understand the disease better, monitor its progress, and decide on the best course of action. Always remember, if you or someone you know is being tested, it's important to discuss the results with a healthcare professional who can interpret them in the context of the full clinical picture.